Hi everyone. Today in this video let us discuss one of the medication Vibegron. What is this medication Vibegron? The suffix begron indicates that this is one of the drug which is indicated for the treatment of overactive bladder. This condition is commonly known as OAB, where the overactivity of the bladder results in increased frequency of urination, which results in severe complications in the lifestyle. Normally the bladder empties the urine, but in the people with overactive bladder, the urination frequency is increased. This overactivity of the bladder may be due to many of the reasons. Among them, any risk of infections may increase the activity of the bladder, or use of few of the medicines which produce bladder constriction, or any damage to the bladder, inflammation. All these conditions may increase the activity of the bladder, resulting in the enhanced emptying, leading to urinary incontinence. So in such people, urine output is increased and they cannot control urination. So in such group of people, we can observe few of the symptoms like increased urinary urgency and increased urinary frequency. Normally the daily urinary frequency may be variable from person to person, but when this urinary frequency is greater than 8 times per day, it may indicate overactive bladder. Sometimes urinary frequency may be temporarily increased, but it can be restored within few days. But in the people with overactive bladder, the daily urinary frequency is above 8 times, along with urinary urgency and the inability to control urination. Even in such people, we can observe nocturia, urination during bedtime, which disturb the sleep. In such people, we can observe increased urination more than 2 times during the bedtime, which severely affects quality of sleep. So these are the symptoms of overactive bladder resulting in urinary incontinence. In such people, Vibegron can be given to relieve the symptoms. Vibegron acts as beta-3 agonist. So it stimulates the beta-3 adrenergic receptors located on the bladder neck, which produces bladder relaxation. So simply Vibegron is a bladder relaxant, and this drug is available as a tablet under the brand name Gemtesa. So today in this video we are going to see how this Vibegron acts as a bladder relaxant, what are the important precautions, side effects, doses, all these points we will cover in this video. So let us start with how this drug acts. The contraction of the bladder can be controlled by many of the neurotransmitters. So many of the neurons can control the bladder activity. Among them, norepinephrine is one of the important mediator. Norepinephrine is a mediator of sympathetic system and acetylcholine is of the parasympathetic system. Both of these mediators can control the bladder activity. Norepinephrine produces bladder relaxation, whereas acetylcholine produces bladder contraction. Now here Vibegron increases the activity of norepinephrine. On the bladder neck, beta-3 receptors are located. Now norepinephrine can act on these beta-3 receptors, which produce relaxation of the bladder. But in the people with overactive bladder, urinary frequency is increased, resulting in the urinary incontinence. In such people, norepinephrine is not sufficient to activate these beta-3 receptors. That's why we can use externally Vibegron. Vibegron is a beta-3 receptor agonist. This Vibegron acts as a beta-3 receptor agonist, which produces relaxation of the bladder. Because of bladder relaxation, the bladder volume is increased, so bladder capacity is increased. Therefore, more urine can be accommodated within the bladder, which reduces the urinary incontinence and urinary frequency. So in such people, Vibegron can reduce the urinary urgency as well as the frequency, which improves the lifestyle. And even the urination during the bedtime can be reduced with use of Vibegron. Now let us see the precautions of this medication. One of the important precautions of Vibegron is that this drug is going to act on the bladder and it produces bladder relaxation, which may result in urinary retention. So more urine can be accommodated within the bladder, which may result in urinary retention. Because bladder is not contracted, instead it is relaxed. So with use of Vibegron, many of the people can observe urinary retention, which is quite opposite to the urinary incontinence. So with overuse of Vibegron, the situation may be reversed and urinary incontinence may be converted into urinary retention. So if you observe any significant urinary retention with low urinary frequency and urinary volume, then Vibegron should be carefully used. And this situation may be more pronounced when this Vibegron is combined with other bladder relaxants. Already we have discussed that acetylcholine can produce bladder contraction by acting on muscarinic receptors. Now muscarinic antagonists like darifenacin, solifenacin, these drugs can act as bladder relaxants. So when these muscarinic antagonists are combined with Vibegron, the urinary retention is more pronounced, which is fatal to the patient. That's why whenever significant urinary retention is observed with use of Vibegron along with muscarinic antagonists, immediately the drug should be stopped in order to avoid bladder damage and urinary infections. And in the people with any obstruction in bladder outlet, again Vibegron should be carefully given because it can also increase urinary retention. So urinary retention is one of the important precautions with this Vibegron. Similarly, few of the drugs like digoxin are mainly excreted within the urine. So their excretion through the urine is very important because this medication is a cardiotonic with narrow therapeutic window. This drug can be used in the treatment of heart failure, but any small change in the levels of digoxin may produce toxic effects of this medication. Now with use of Vibegron, we can observe some urinary retention, and since urine is retained, the excretion of digoxin is reduced, so which may increase the serum levels of digoxin. This increases the digoxin toxicity, so with use of Vibegron, the dose of digoxin should be reduced in order to avoid any digoxin toxicity. Now let us see the side effects of this medication. Vibegron produces various side effects like headache, diarrhea, it can produce some nausea, even it can produce nasopharyngitis and cold-like symptoms. Urinary retention is one of the important side effects that can be observed at prolonged use and along with muscarinic antagonists. Even this medication can produce pruritus, some itching sensation. Apart from these side effects, it can produce dry mouth, hot flush because of increased vasodilatory response, and even it can produce some upper respiratory tract infections as well as urinary tract infections in the people with urinary retention. So these are the common side effects that can be observed with Vibegron. Now let us see the chemical nature of this medication. So this is the structure of Vibegron. We can see a large structure, but here we can observe one of the fused heterocyclic ring system. Let us give the numbering. This is 1, 2, 3, 4, 5, 6, 7 and 8. So this is simply a fused ring system with pyrimidine fused with pyrrole. So we can write this as pyrrolopyrimidine. The attachment is at the first and second position of pyrrole and A side of the pyrimidine. So we can write this as 1, 2A. So this is the ring system present in the Vibegron. Now to this ring at the sixth position amide is attached. So we can write this as 6-carboxamide. And to this amide on the nitrogen phenyl ring is attached. So we can write this as N-phenyl. To this phenyl at the fourth position or para position, methyl group is attached. So 4-methyl. Now to this methyl group, again another heterocyclic ring system is attached, that is again pyrrole. Now let us give the numbering to this pyrrole. This is 1, this is 2, 3, 4 and 5. Now pyrrole is attached by second position, but it is completely saturated. So we can write this as pyrrolidine. This pyrrolidine is attached by second position, so pyrrolidine 2-ol. Finally, at the fifth position, another chain is present, which is nothing but phenyl methyl hydroxy. So we can write this as 5-hydroxyphenyl methyl. That is the complete name of Vibegron. So Vibegron is a pyrrolopyrimidine derivative. How it is given? This drug is available as a tablet at a strength of 75 mg, and the dose of this Vibegron is given as 75 mg, given as once daily. This tablet can be taken either with or without food, but the same time should be maintained on each day. And if it is required, the tablet can be crushed, and even it can be combined with applesauce in order to mask the bitter taste of this tablet, as well as to reduce the nausea with this medication. So that's all about this medication Vibegron. Vibegron is a beta-3 agonist which acts as a bladder relaxant. It stimulates the beta-3 receptors located on bladder neck, which produce bladder relaxation, so bladder capacity and bladder volume is increased, which reduce the urinary frequency as well as urinary urgency. But at the same time, Vibegron may increase the risk of urinary retention, particularly when this drug is combined with muscarinic antagonists like darifenacin and solifenacin. Even in the people with any obstruction in bladder outlet, again this drug should be carefully given as it may increase the urinary retention. Common side effects mainly include headache, diarrhea, nasopharyngitis, urinary retention, and urinary tract infections. This drug is given as a tablet at 75 mg dose given once daily. It can be either crushed or it can be combined with applesauce. It can be taken to mask bitter taste and to reduce the nausea with this medication. So that's all about information of Vibegron. Hope you have enjoyed this video. If you really like this video, please subscribe to our channel, share this video with our friends, post your comments in the comment box. Thank you for watching this video.